relative to the articular surface of the scapula, the glenoid, is described as spinning, sliding, and rolling. Shoulder motion and stability is achieved via the coordinated contraction of the deltoid and rotator cuff. The deltoid is the largest muscle in the shoulder. It elevates the arm. The deltoid consists of three distinct heads: anterior, middle, and the posterior. The middle deltoid wraps around the greater tuberosity to generate a stabilizing compressive force. The rotator cuff is composed of four muscles that generate the torque necessary for rotation. The anatomic arrangement of these muscles generates humeral head compression and glenoid centering at all joint positions. Muscles generate forces that are converted to torques in proportion to the perpendicular distance between the joint center of rotation and the muscle's line of action. This distance is the muscle's moment arm. The larger the moment arm, the greater capacity for that muscle to generate the torque required for motion and support external loads. The location of the moment arm relative to the center of rotation determines the type of motion the muscle creates. Shoulder muscles with lines of action superior lateral to the center of rotation generate abduction. Lines of action inferior medial to the center of rotation generate adduction. Lines of action anterior to the center of rotation generate internal rotation. And lines of action posterior to the center of rotation generate external rotation. Rotator cuff tears have negative consequences on motion and stability. As the rotator cuff fails to balance the deltoid, the humeral head migrates superiorly and impinges with the acromion, leading to further tearing. Dr. Charles Neer coined the term cuff tear arthropathy, or CTA, to describe this arthritic, eroded condition of the glenohumeral joint following prolonged subacromial compression.